Hello, and thank you for joining me for this educational presentation on the effects of suicide, a true problem in the community. Today, we're going to talk about identifying risk factors for suicide, discuss accuracy of screening tests, and effectiveness of early detection. Risk factors based on demographics of the population. Men have a higher risk at ages 50 to 54 years of age. Women, the risk increases at 60 to 64 years of age. Native American, Alaskan Natives, along with non-Hispanic whites, are at increased risk. Highest risk seen in Native Americans and Alaskan Natives, ages 19 to 24, and non-Hispanic white persons over ages 75 years of age, which we're going to talk about a little bit later. And adolescents, Hispanic females are at higher risk. Mental health disorders increase the risk of suicide. This can include schizophrenia, bipolar disorders, anxiety disorders, and of course, depression. About 87% of patients who die from suicide meet the criteria for one or more of these mental health disorders. A lifetime of depression doubles the risk of suicide in adults. So depression has been singled out as the most important identifying risk factor for suicide. So if depression is targeted as a root cause, a lot of the other mental health disorders kind of fall into place. Adverse childhood events, family history of suicide, discrimination of being part of the LGBT community, access to lethal weapons, history of being bullied, and history of chronic pain are all contributing risk factors. Older adults who have things like chronic pain, physical illness, impairment, or suffer from social isolation when they get older in age. Their loved one may have passed away. Things like this are at increased risk for suicide. As I mentioned, um, persons over 75 years of age and the non-Hispanic white community are at highest risk. Um, so that would include these factors. Uh, it has been pointed out that a lot of people are seeing their primary care provider within a month. These are adults of committing suicide. So people who have committed suicide have seen their primary care provider recently. Youths, 90% of them saw a primary care provider within a year of committing suicide. So it was determined that they should try and create a screening tool for these patients because obviously they're in a clinic seeing their provider. So they wanted to create screening tools that may predict suicide in these populations. However, there's no evidence that these tools are actually working to prevent suicide. So a number of studies were conducted, however, none of them showed any good evidence. Early detection is key for preventing suicide. So, as I mentioned before, there's been attempts to create these screening tools, but they have not been shown to be effective. But once suicidal behavior is identified, there's many different avenues for people to get help. Seeing a therapist has been shown to be effective. Psychotherapy is the number one treatment right now. More information is needed on how to prevent suicide. However, there are some effective treatments, such as focusing on depression as the root cause, has been shown to encompass a lot of other problems in the community. So, someone may have schizophrenia or may have a different mental health diagnosis. They may have a traumatic event in their past, but it has been shown that if you focus on depression as the root cause, these groups also don't feel left out because a lot of them may be experiencing depression along with the other issues that are going on. These are my references. I pulled a lot of this information from the Healthy People 2020 recommendations and a study on prevention of suicidal behavior. Thank you.